Hi, this is Josh Hubert from the class of 2019. I have to apologize for the way that my voice sounds. I'm a bit under the weather, and so my nose is a little stuffed, but I'm coming to you live to strongly recommend the Advanced Neuro Elective if you're considering taking it. One thing I would say that I've come to appreciate over the course of this past clinical that I've spent at Shirley Ryan Ability Lab in Chicago doing spinal cord injury rehab is just the multidimensional nature of care that is required for patients with neurological injuries and all that you're expected to account for as the therapist in these situations. And so I would say, as a new grad or as a student on a clinical rotation, it's really tough to have all these different dimensions of care be a part of your previous knowledge base. And I would say that that's exactly what the Advanced Neuro Elective kind of offered me, is just this initial exposure to all these different layers that go into neuro rehab. And some of those things that we got the chance to go over in class are just handling techniques to kind of save our backs and improve our mechanics when we're working with patients that require a lot of assistance, fitting equipment and orthotics, and then educating your patients on how to use them or wear them. Also, just exposure to kind of technological equipment and things that are used in neuro rehab and not as much in other realms of therapy. We learned how to interact as part of an interdisciplinary team because there are so many people on the care team when it comes to patients with neurological injuries. And then we also learned, went over a bit how to train caregivers and just educate somebody who may be required to do a new skill, how to maintain good body mechanics and really do the best that they can for whoever they're providing care for. And last but not least, I just wanted to mention two things I really enjoyed as part of the class. One was a session we spent going over some treatments that I would say typically would be considered under the orthopedic category of interventions, but we went over them as they applied to the neurological population and looked at the research that backed them, and then kind of looked at a case and how they applied and how they were really effective for one patient. And then another session we spent kind of talking about the human aspects of care with this population and being a part of somebody's life when they're going through some pretty tough times and experiencing really significant levels of change to their identity and their functional capacity and things like that. So just getting a little more acquainted with navigating those conversations and those interactions to really be the most effective therapist that you can. And so I would say if you're considering taking the elective, definitely do it. It was very nice to drop in and talk to you all.